Hello, everyone. Welcome to episode 1 of Prentice's Rule, an avenue for discussion, knowledge, and fellowship with focus on your eyes, the face that surrounds them, and the humanity behind your spectacles. While I am an eye care professional on the path to better understanding, I am not a medical professional, and as such, please seek the advice of a medical professional if needed. I am a dispensing optician, and I was not that for most of my existence. I worked backstage in theater for close to 30 years, pulling ropes, making shows run, making performances happen. And then I needed to start wearing eyeglasses of some nature. And there were some issues. And we'll talk about that more in a later episode. But at present, I am a dispensing optician. And after choosing to become that, and leaving theater and enrolling in opticianry school, I sent out letters of introduction to area optical shops in search of a mentor. I was fortunate enough to find one, a mentor and a friend, who asked me 3 questions. Why did I want to become an optician? How good was I with my hands? And how do you spell ophthalmology? Well, speaking of 3s, that profession is one of our 3 O's. Let's explore. Episode 1, the 3 O's. Optic, O-P-T-I-C, is from the late 14th century optique, O-P-T-I-K, of or pertaining to the eye as the organ of vision. It's from the Old French optique, O-P-T-I-Q-U-E, also optique with a B, and that's around 1300 CE. Also directly from the medieval Latin opticus, of sight, or seeing, from the Greek optikos, O-P-T-I-K-O-S, of or having to do with sight. Also from optos, O-P-T-O-S, seen or visible, related to the suffix ops, meaning eye, as in cyclops. Ophthalmo, O-P-H-T-H-A-L-M-O, used before vowels, ophthalm, is the word-forming element meaning eye, mostly in plural, the eyes, from Greek ophthalmos, eye, originally the seeing. And those are from etymonline, etymonline.com. Ophthalmologists are doctors of medicine, hence the MD behind their names, whom specialize in eye care, be that optical, medical, or surgical. From the American Academy of Ophthalmology, ophthalmologists are eye physicians with advanced medical and surgical training. Ophthalmologists complete 12 to 14 years of training and education, including medical school, and are licensed to practice medicine and surgery. Typical training includes a 4-year college degree, followed by at least 8 years of additional medical and surgical training. An ophthalmologist diagnoses and treats all eye diseases, performs eye surgery, and prescribes and fits eyeglasses and contact lenses to correct vision problems. More on that later. Many ophthalmologists are also involved in scientific research on the causes and cures for eye diseases and vision disorders. Because they are medical doctors, ophthalmologists can sometimes recognize other health problems that aren't directly related to the eye and refer those patients to the right medical doctors for treatment. Again, this is from the American Academy of Ophthalmology. Optometrists are healthcare professionals with a specific degree in eye care. In the United States and Canada, that's the Doctor of Optometry, abbreviated OD behind their names. Optometry, this is from the World Council of Optometry. Optometry is a healthcare profession that is autonomous, educated, and regulated, licensed and registered. And optometrists are the primary healthcare practitioners of the eye and visual system who provide comprehensive eye and vision care, which includes refraction and dispensing, detection and diagnosis, and management of disease in the eye, and the rehabilitation of conditions of the visual system. Again, this is from the World Council of Optometry. Opticians specialize in the fitting, fabrication, and maintenance of ophthalmic lenses, spectacles, contact lenses, low vision aids, and ocular prosthetics, the prescriptions for which must come from an MD or an OD. In the U.S., licensure of opticians is handled on a state-by-state basis, and while there is a national certification program, certification is not required on a federal level. First part of that was from Wikipedia. This is from the American Association for Pediatric Ophthalmology and Strabismus. We will get into these terms at a later point. All of this matters. Some of these are Greek to me, but necessary terms, terminology, and genuinely the understanding thereof is a primary force and factor behind my beginning this podcast. Again, from the American Association for Pediatric Ophthalmology and Strabismus. Opticians are technicians trained to design, verify, and fit eyeglass lenses and frames, contact lenses, and other devices to correct eyesight. They use prescriptions supplied by ophthalmologists or optometrists, but do not test vision or write prescriptions for visual correction. Opticians are not permitted to diagnose or treat eye diseases. We'll get into that a little bit later as well. So in my experience, most ophthalmologists, the MDs, while excellent at their specialties, typically, not always, but typically, do not perform anymore their own refractions, opting instead to have their technicians refract the patient. And that's where you sit in front of the phoropter, which is better, one or two or three, right? Optometrists, at present, typically do not do or perform the fitting of the spectacle. Either ophthalmologist or optometrist typically will take a hand in the fitting and have to for the proper fitting of contact lenses. But for, particularly in licensed states, for the practicum of the patient trying the contact lenses, getting used to inserting and taking them out, it is more often than not the technician in the ophthalmologist office can be either the optometrist or their technician. In licensed states, it's the optician that is helping, once prescription has happened, helping the patient discover how best to insert and remove their contact lenses. We will only barely touch on contact lenses, at least for the beginning of all of this. My focus throughout this podcast is going to be opticianry and primarily eyewear. But always, it is vital to work in concert with the medical professionals without a proper correction. And sometimes it takes multiple, either visits with the same doctor or visits with multiple doctors, to dial in the proper correction for where your visual system is at present. Without that, the best looking frames are worthless for our purposes, unless they're used for costume or, just so you can look intelligent, or in other cases, they are a means of cosmetic outlook change for the individual. At any rate, that is a basic laying out of what the three O's are. That is a basic, hopefully, understanding of the people that deal with, are concerned with, and genuinely want to help you with your eyes, their being able to see as well as possible. And hopefully, you'll look as well as possible so that you'll want to wear said correction. And that last part is up to the optician. What I typically see, and this isn't always the case, but typically an optometrist practices and then the optician fits with regard to spectacles. And most of the MD shop locations where I've been, once you have your prescription, if there's not an adjoining optical shop, then there are recommendations made. We'll get into all of that. It's either going to be a full episode or just a one-off supplemental. What is Prentice's rule? Why does it matter? Why is it important that that be considered so that we can remain in focus with regard to our visual system? Thank you. Episode 1 is done. Here's to many, many, many more.